Hello there. Thank you so much for showing up on my channel. I'm glad that you are here. Today we're talking about what happens if you don't treat a yeast infection. Yeast infections are oh so common that a majority of people will experience, meaning females, will experience a yeast infection at some point during their reproductive lives. And so because of that, we're going to talk about what exactly is a yeast infection, what are the symptoms, what do you expect with a yeast infection. We'll talk about when do yeast infections resolve on their own, and then we'll dive into what are the risks to your system if you have an untreated yeast infection. So let's start by talking about a yeast infection. A yeast infection is an overgrowth of yeast in the vaginal space. It is where the microbiome, which in the vagina comprises of a lot of bacteria and different things, and yeast is one of them. It lives there normally in a normal amount. Whenever you have an overgrowth so that there is more yeast than should typically be there, you can get an infection. These infections will be supported by having symptoms like itching and inflammation, and sometimes you can even have a little bit of like discharge from not only the yeast but from irritations of the area. That discharge may look like white cottage cheese, thick and clumpy type of discharge, but that's not always the case. That's just typically what we see and what we find. If you think that you have a yeast infection, I always recommend that you see a doctor, you get tested, and have your sample actually sent off to the lab. The reason for that is sometimes we self-diagnose ourselves. And we're like, oh, I know what I have. It's a yeast infection. I'm just gonna go to the pharmacy and pick up a medicine over the counter. Sometimes that's okay. However, sometimes you can have a yeast infection that is caused by a version of Candida, which is yeast, that is resistant to antifungals. And how would you know that you have a resistant version of a yeast infection? Number one, you keep getting treatments and the symptoms continue to recur. You're not getting any relief, or if you do, it's for a short period of time and then it comes right back. Or you go to your doctors, you get your discharge sent off to the lab. The lab will tell us, it essentially give us a report of the exact types of yeast and whether or not they are resistant. Knowing that information is very, very helpful. Now, if you've only had one infection, you took an over-the-counter treatment and it went away and all is well, then we have nothing to worry about. But if this infection stays around for quite a bit, then you absolutely want to get tested before you do treatment. Very, very mild versions of yeast infections may resolve on their own, especially if we have very healthy individuals that are essentially in a place where their bodies are well balanced. Now, a majority of people are on the other side, where if they have an untreated infection, their symptoms will worsen and worsen over time. Progression of your symptoms over time may lead to your skin breaking down. And by breaking down, I think of this as your skin barrier being open. So think of getting like paper cuts, okay? So it's almost like you're getting paper cuts in your vulva, in your vagina, because your skin isn't able to maintain its integrity. And so it breaks. And when that happens, that increases the likelihood of getting other infections. So when we think of things like STDs, for instance, or other bacteria that can be located anywhere, that can get into an open skin space, this is oftentimes what bacteria is like dying for, like the opportunity to cause infection somewhere and multiply. We don't want this to happen in our vaginas. We don't want this to happen because of a yeast infection. And so in these scenarios, it's very important that whenever you have symptoms that you are tested and you get appropriately treated, so we don't ever get to the point where our skin starts to break down. Sometimes if we have this untreated yeast infection, you may also start to have a lot of pain with sexual intercourse. I mean, the area becomes so inflamed that Even a light touch to the area can cause significant amount of pain. Chronic infections can also lead to a breakdown of your immunity. You know, this is something that we often don't think about, right? But our vaginal space is also a reflection of what our immunity is like. And so if we have this chronic infection that is untreated for long periods of time, months and years, our immunity can also decrease and is not as strong as what it normally would be. Now, overall, I can tell you that chronic yeast infections can cause a lot of distress. Sometimes you can have so much itching that you're just like, I cannot just go about my life because it's disrupting things too much. Sometimes it can cause a lot of mental and behavioral health issues where we're stressed out. Your sexual life can be impacted because you don't want to be touched, seen, you don't want to be involved in sexual intercourse. Socially, just become so irritated and not wanting to socialize. And so having untreated yeast infections can really impact us in ways that is usually unwelcomed. Now, there are special circumstances also where having an untreated yeast infection can be a bad thing. The first is if you're in an immunocompromised state, which means that your body is not as strong, your body is ill, your body is in a place where it's fighting other things. So this could be with infections like a yeast infection. Sometimes we could have an autoimmune issue. We can have cancer. You know, your bodies are preoccupied with fighting other things that you are more susceptible to infections that can become more systemic. We find that yeast infections that may start in the vaginal space can easily actually spread throughout your system if we're in an immunocompromised state. We also know that with pregnancies, yeast infections can be a problem as well if left untreated. They can lead to preterm labor. During vaginal births, especially, there can be a transmission from mother to child of yeast, and so your baby can be infected as well. And one way that your baby may show this is by having thrush. It's not the only way, but it's one potential way as well. And so pregnancies can absolutely be affected. If we have a yeast infection, if we suspect that we have a yeast infection, we want to get treatment, and we want to get treatment right away. The best thing to do is to be tested so we know exactly what type. The second best thing that we can do is start treatment with over-the-counter treatments with an antifungal suppository. And this is helpful if your doctor say you're not able to get an appointment anytime soon. So start the treatment at home if necessary. But if you can, do your testing first. The third thing that I'd like to mention here is that when you are undergoing treatment, it is important that you complete treatment before you stop. I find patients stop taking their medicines as soon as they feel as though the irritation and inflammation and the discomfort that they had went away, or their discharge went away. But if your treatment course was for 7 days and you're 5 days in, it is important that you finish the last 2 days. Finish your treatment completely to ensure that we decrease the likelihood of developing a resistant form of the yeast over time, but also to make sure that your symptoms are not recurring and your need to see the doctor isn't increasing because we just didn't complete our treatment. Okay, does that make sense? I hope it does. Thank you for being with us today. I think that there's another video that would be very helpful to you, and you can find that below in our description under this video. Go ahead and click on it, come on over to the next video, and let's talk a little bit more about the changes that may occur vaginally, and especially with yeast infections. Take care.